Good evening, everybody, and welcome to this full meeting of the Children's Services Overview and Scrutiny Committee, held in part via MS Teams. Please note that this meeting of the Children's Services Overview and Scrutiny Committee is being live streamed and will be recorded by the Council to support the production of minutes for the use of democratic services. To ensure the meeting is managed effectively, please could everybody follow these ground rules for speaking. Only speak when invited to by the Chair. Mute your microphone when you're not talking. If accessing via Teams only, always turn on your video function when invited to speak and state your name. Please use your microphone when speaking, and please mute or turn off your microphone when you're not talking. If you would like to speak on an item, please do so by raising your hand, either in person if you're in the room, or on Teams, raise it in the Teams window. For those people here, slight change. I think we have more people in the room now than on Teams, therefore we'll go for the first raising in the room, and I'll try to keep an eye on the Teams. If there is a lot of fire alarm sounds, please exit the building now by basically following Louise. We tried it out earlier. We know the way out. Louise knows the way out, so it's down the stairs. Don't go too fast. Finally, please can ensure the background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. So, item 1, apologies. I know I've had apologies from Councillor Jane Kelly and Councillor Nick Gearing. I've also had, although they're not members of the committee, apologies from Mike White, who's one of the portfolio holders. And I also know that both Kathy and Rachel, who are normally here, are involved in some other things tonight, so they can't attend. Do we have any other apologies? Apology from Councillor Phillips as well. So substitute members, I've got Councillor Simon McCormack is substituting for Councillor Geary, and Jackie Edwards is for James Kelly, and David Kelsey for Councillor Phillips. Just one thing for those people, because I know there's a couple of you who haven't been on children before, I do tend to use first names during the meeting in children's, as long as you're all happy with that. So for those people not being here before. So item 3, I now have to pass over for the election of chair to my current vice chair.
Thank you, Richard. Can I ask for nominations for the chair? Eddie Coop.
Yeah,
Thank you. And a seconder. Thank you. Are there any other nominations? So, therefore, Richard is going to do a very good job again. Thank you.
Thank you very much. So we're now on to item 4, election of vice chair for Children's Services. Do we have any nominations for vice chair? Councillor
David.
Councillor David.
Thanks, Richard. Could I nominate Sean, please?
You can. And do we have a seconder?
Yes, have a second, Chair.
Okay. Thank you. Do we have any other people nominated for vice chair?
Yeah. Sorry about this. I'll get there in the end. I have absolutely no problem with Sean at all. He's a really nice guy, my ward colleague, but I was going to propose Councillor May Haynes, largely because she's been around to these meetings in the last couple of months, and she's shown a huge interest, and I think with her previous experience, she would actually be really useful to the meeting. That was my thoughts. And she's going to tell me she doesn't want to stand.
Yes, Chair. I thank Sandra for her very kind words, but I decline. Thank you.
Okay, in that case, it's pointless me asking for a seconder, isn't it?
I tried.
Anybody else? Any other nominations? In that case, Sean, you are now Vice Chair of Children's. Well done. Before you take your place, may I just thank Lisa very much for the time she spent as Vice Chair. It's been an interesting 3 years, all the way back.
Yes,
And
it's
thank
been
you for your
very
help and
interesting.
support and phone calls and attending meetings and reading stuff. You've been a great help.
And it's been really good to work with you, Richard. Thank you.
David.
May I just on behalf of our group copy what you've just said and say thank you to Lisa for all the work that she has done. She has been a really good Vice Chair and we really appreciate what she's done. So thank you very much, Lisa.
Thank you. Noted. Okay, I can just see, Sandra, your hand is up at the moment. Is that, have you? Right, okay, thank you. So before we go on to item 5, declaration of interest, you've now discovered what one of the advantages of being Vice Chair is, because there are only 3 comfortable seats in the room. And you have now one of them. Item 5, declarations of interest. Do any councillors have any disclosable pecuniary interests or any local interests on any items on the agenda? It looks like not. Okay, so item 6, minutes. We've all had a chance to have a look at the minutes. Any points on any of the minutes? Any disagreement with them? So I'm assuming if nobody shouts at me or waves their hands that we're all happy with the minutes. The action sheet, as normal, there have been some actions happened on the action sheet. There are still some actions that are to be actioned. Any comments on the action sheet at all? In that case, we'll move on to item 7. Public issues. Can I just check with Democratic Services any public issues?
There's been no public issues received, Chair.
Right, thank you. In that case, we're on to the Youth Justice Service Annual Youth Justice Plan. It's page 19 to 62 on the papers. So the Annual Youth Justice Plan is a statutory requirement. The plan needs to be approved by full council and we need to decide if we recommend it. And I'd like to welcome David Webb, who's the Manager for Youth Justice Services, to present the report. So you're welcome, David.
Thank you, Chair. Over here. If I just give a brief overview, Chair, is that satisfactory? And then
yes, yeah, assume everybody's read the papers and just point out, give an overview and point out anything you'd like to highlight.
Thank you. So, as stated in the paperwork, it's an annual requirement to publish a youth justice plan under the Crime and Disorder Act. The Youth Justice Board oversee this process, and this year they've issued much more detailed and prescriptive guidance about the contents of the plan and issued a template that has to be followed. So the plan that you're looking at tonight is a longer document than in previous years and covers a wider range of areas in line with the Youth Justice Board guidance. The key performance indicators for youth justice are currently reducing the rate of first-time entrance, so stopping children entering the justice system. And we can see that in the previous year, we've continued the reductions of the preceding years. So we're pleased that the direction of travel is to reduce the number of children entering the justice system. There are also key performance indicators relating to the rate of reoffending by children who do enter the justice system and the use of custodial sentences. In both of those areas, we've maintained a kind of level of performance similar or just below to regional and national averages. The funding, the Youth Justice Plan needs to set out the resources and funding available to the partnership, as well as the partnership arrangements. I've noted in the report that at the time of writing it, the Youth Justice Grant for this year had not yet been announced. The Youth Justice Grant forms about 30% of the services budget, and obviously the year began on the 1st of April. We're still awaiting announcement of the Youth Justice Grant for this year. The context for that is an announcement about 10 days ago from the government, indicating an increase in funding to youth justice services with some additional expectations. The details of those expectations and the exact sum of the grant for this year has not yet been revealed, but we've been assured that we will not be seeing a reduction in the grant this year. Our priorities for the year ahead arise, so hopefully the logic of the plan flows to lead to the conclusion with the priorities for this year, which are to continue to reduce the numbers and rate of children entering the justice system, to address issues of over-representation of specific groups in the youth justice system. There are still some issues locally. When I talk about our youth justice system, I'm thinking about things like the way that our work happens with police and court colleagues, so that if a child is identified for an offence, there's a swift and fair process to deal with that offence. And there's still improvements to be made, and in terms of certainly the timeliness of children appearing in court. We're also looking to do some practice improvements within our service to continue our direction of travel of being more collaborative with children and families that we work with, giving them using their voice more clearly in our work, and building on the activities that we undertake with young children, with young people and children, to build on their strengths. I think that's all I wanted to say, really, in kind of introducing the plan.
Thank you very much for the introduction. If I just start with a question, and then I'll see if anybody else has got anything to ask. I think you probably know where I'm going to go with this one. Looking at percentage male and female in the youth justice system. So we've got 51.4% male, 48.6% female, which adds up to 100%. So is this because less than 0.5% of the BCP youth population of another gender, or do we have no other gender people in the youth justice system, or does it not count in the document, in the numbers?
Thank you, Chair. I think the data that you're referring to is the demographic data for the whole of children in BCP, rather than those known to the Youth Justice Service. So that on page 4 of the plan, page 26 of the meeting papers. So that's the overall context for children in the local area. In terms of the numbers in contact with the justice system, it's more like 80% male, 20% female. But I understand the substance of your question, which is the gender identity of children who elect a different gender from their birth sex. The position is, as I understand it, having spoken to colleagues in data management, nationally there is still a government position of identifying male or female based on birth sex. The desired sort of forward position for recording this would be potentially to have two markers of the sex and a gender, so that the selected gender could be recorded. And we recognise that it's one of our priorities for this year that I don't think we've really cracked this yet in terms of our area of work. So recording of children who elect a different gender or other kind of gender and identity issues is something that we need to do, as well as actually responding to those children and giving a really individual response to each child. But I don't, in terms of the content of your question, you also asked about the numbers represented in our service. It is just about below 0.5%, I think, but it's of that kind of order.
Thank you for that answer. So it'll be interesting next year to see if with the same people in the room next year, whether that will be mentioned then. Has anybody else got any questions? Yeah, May.
Thank you, Chair. Thank you for the report, David. It's actually, I have to say, a very readable report, which I could actually understand. So well done on that. So at the start of the actual report, where the introduction bit, paragraph 4, it refers to current counting rules for the measure on reoffending rates. It kind of jumped out at me because I'm thinking, well, if the rules do change from one year to the other, how does that actually affect our ability to be able to have proper comparative data sets?
Thank you, Councillor. The reference there was that the national counting rules from the issue by the Youth Justice Board did change a year or two back to go to a different cohort each quarter rather than a rolling cohort, so that under which the next quarter was added and the first quarter was removed. So it has led to more fluctuation each time. I should perhaps also have said in my introduction that along with the funding announcement that I mentioned nationally, the government have also, the Ministry of Justice and the Youth Justice Board have indicated that they plan to change the performance measures for youth justice. So the current key performance indicators will still be reported, but will no longer be described as key performance indicators. And there's a proposed set of 9 new indicators that feature things like the numbers of children in the youth justice system with suitable education, training and employment, the numbers with suitable accommodation, numbers known to children's social care, receiving mental health services, and some other measures as well to do with serious youth violence and the use of out-of-court disposal. So there's a new set of measures being consulted on at the moment.
Thank you for that. So it's almost like it's a bit of a moving target in some respects. The other point I wanted to raise, Chair, is the diagram on page 30 per our agenda papers. I'm looking at it, and just I think further down in the paper it talks about the experience of the individual and how sometimes they're confused about what's happening. Looking at that chart there, I'm thinking, I'm not surprised if this is their first experience and they're having to deal, I know because of the nature of what we're dealing with here, it has to be a multidisciplinary team, but nonetheless, it's just strikes me as being really overwhelming for the young person that have so many people involved. And so I guess what I'm trying to clarify is everything done through their social worker, their youth worker, or do they then have the experience of having to deal with various different people, which would then make it even more distressing for them?
So you're right, the relationship is the key to our work, and that diagram is intended to show all the possible kind of permutations and links that we've got, and to illustrate the fact that being a multidisciplinary service and child offending being so linked to so many other issues, our work has kind of tentacles into lots of different areas of children's services in the criminal justice system. But for each individual child, they would be allocated what we might call a case manager, so a youth justice officer or a youth justice worker, who would meet them and undertake a really comprehensive assessment. And then they might bring in some of those specialist workers that we have in the team. So, for example, we might ask our speech and language therapist to undertake an assessment of the child's communication needs. We might bring in one of our CAMS nurses or our education specialist, but we do that cautiously, partly because of the capacity of those workers, because there's not many of them and there's a lot of children on the caseload, but more so because we're really aware of the point I think you were getting at, which is for each child, where they may well have had contact with multiple professionals already, and they may well have attachment and trauma issues arising from their earliest life experiences that make forming new relationships difficult. It may well be that actually our case manager would be the person doing a direct contact, and the other workers would be providing consultation and advice to them, but not meeting the child directly.
Okay, no, I'm just conscious that this is actually is a plan. So to say that that is actually built into the plan somewhere, because I was reading it thinking you've got the what, you've got the what needs to be done, but it's a case of, I think the bit that's the how we're doing it is kind of not quite clear, but that really explains. So thank you very much, David.
Thank you for those answers. Lisa, I think you were next.
Thanks, Chair. Yeah, thanks for the report. I'm just wondering, because it mentions that the annual youth justice grant was 790,000 back in 2014-15. Now it's actually £130,761 less. Although, of course, as you say, we don't know what what's going to happen for the next one. But how do you manage, given the rate of inflation, how do you manage with so much less than you had?
I think that's probably one of the main reasons I think we've been able to absorb that level of reduction. And alongside that, as I've kind of illustrated in there, the local partners' contributions have stayed basically flat. I think it was 1 year of about 2% increase, but basically since 2014 they've stayed flat, and obviously costs have risen in that time. The decision which was taken in about 2013-14 but came into effect in 2015 to merge the Youth Justice Service across the 2 local authorities, or 3 local authorities as it then was, really gave us much more resilience to cope with those reductions. So we've managed to maintain the multi-agency, multi-disciplinary identity that we were just describing, which is the essence of a youth offending team as they were set out in the original legislation. But I think working at making some savings at scale, operating with one case management system, one youth justice manager, one kind of education worker, and so on, we've been able to manage our budget successfully. So we stayed within budget in each of those years, and the expectation from the government is to, as I understand it, nationally, the grants disbursed to youth justice services this year just finished was amounted to 82 million. The plan is for that total to rise to 88 million this year. So there's an extra 6 million to be distributed across the 138 youth offending teams across the country, with an expectation it will rise again in the next 2 years. But as I said earlier, we're not clear yet what the additional tasks we will be expected to undertake in kind of return for the money. But it's welcome to think that the threat of further reductions appears to have receded, and we may be now going to get some increase.
Thanks. It's just, I mean, I noticed that it mentioned that the young people who reoffend are more likely to have complex speech and communication needs, as well as other, experience traumatic events, etc. And there's only something like 1 speech and language therapist. And I was thinking, wouldn't it be preferable to have more so that they could be?
We've got 1.4 full-time equivalent. I had a conversation this morning with our person who works 2 days a week with 0.4, and along those very lines, we're struggling for them to meet and undertake the proper speech and language assessment with young people. And as we were talking about earlier, often these young people take a bit of time to build trust. So it can be several sessions and take skill to do that. And then there's a background reading to do and a report to write. So their capacity to assess every child, which is what we would like, is probably not there at the moment with our current numbers, and we are having to think a bit about how we prioritise. And one of the difficulties with that is when they joined our service in 2018, which was a massive advantage to have them join our service, we started off by our case managers making a referral if they thought a speech and language assessment was needed. What they discovered, and what our speech and language therapist said, was you can't tell from talking to someone if they've got speech and language needs. These are teenagers that may well have mastered those needs for years. It hasn't been picked up in school settings where you might well expect it to. So really, we need a blanket approach to just assess everyone. And those, when we can do that, we do see about 80% of the children we work with do have communication needs.
Yeah, thank you very much for that. I've got something to sort of follow on with that, but I'm going to let Sandra go first because, it was just with looking at the, as you were talking about speech and language and trauma recovery, which I think overlaps with this. So young people in the youth justice system have often experienced past trauma. Is there a number, a percentage? And are there any underlying reasons? What work's been done on that?
I don't have a number to quote on it. It's something that perhaps we should do. I think the underlying is something we recognise for a long time. There was some research done using the phrase adverse childhood experiences, trying to structure this area of inquiry so that 9 different categories of adverse childhood experiences were listed, and it was recognised that children with 4 or more were much more likely to end up with negative outcomes, such as being in the justice system. But each individual child could have one adverse childhood experience, and it could be catastrophic and on its own. So it's at a kind of population level you can do that thing, at that kind of assessment. At an individual level, you need to understand each child's own experiences, but those kind of early experiences are crucial. And in the report, I do list or refer to some analysis that I undertook of children aged 13 and under who entered the justice system in the last 2 years or so. And there were, in the period April 2020 to January 2022, there were 25 BCP children who entered the justice system aged 13 or younger. 24 out of 25 were first known to the police as a victim or witness of harm. So in other words, their kind of first entry onto a police recording system was they were a child in a home where there was a domestic abuse incident, or they were the victim of physical abuse. So that's the kind of indication of trauma that we're getting. It's very common, and obviously when those things happen, we understand better and better when those things happen in the first years of life, the first months even, or even in utero in some cases. That affects the emotional and cognitive development of the child and their ability to form relationships, which takes us to the point that Councillor Haynes was raising about how sensitive the work is to build those relationships.
But thank you for that answer, and you're right, because the word trauma is such a broad term, and I also share your interest in getting some data, because it helps explain to people who are, because a lot of these people are also victims, aren't they? It's Sandra is next, and then Zara.
Right, thank you, Chair. While I'm pleased that the number of first-time entrants into the system in BCP is reduced, I believe I'm right in saying that there is actually a bigger decrease in the number of first-time entrants into Dorset. And I was really wondering why, and what are they doing that we're not, and can we copy them? If it's worth copying.
I mean, there are. It's interesting to me that getting the demographic information together for this report up at the front of the Youth Justice Plan suggests that actually the demographics of the two local authorities, even down to the population of children, are actually very similar. But I would say still there are some demographic, there's some kind of experiential differences living in a kind of big geographical area like Dorset compared to BCP. In terms of children's services, I'm lucky to be able to work across two local authorities, and Dorset are perhaps further forward in terms of developing a really structured, strategic approach to early intervention, based in Dorset's case, which obviously reflects their geography, on 5 localities with integrated children's services in those localities, and a youth at risk meeting in each locality to identify children coming to attention so that early intervention could be put in place, and a multi-agency team to prevent children entering care or entering the justice system or getting other negative outcomes. So I think there probably are some differences in the setup between the two local authorities.
Thank you. Thanks, Chair. Can we make that, some sort of note, because early intervention is clearly the key here.
Yeah, it does seem to be.
Yeah, I think it's probably, we knew it anyway. It's just that, we need it recorded somewhere.
Yeah, so sometimes it's nice saying it out loud and recording it.
That's exactly right, yes.
Zara.
Okay, I just want to start by saying that I'm so glad that we finally met this kind of correlation between early childhood trauma and actual future crimes, because it's something that we've always been aware of and yet we've never actually took action on, because unfortunately when someone has already committed these crimes it is too late to start intervening with local youth. But by directly going to the root of the issue, which we've now noticed there's a huge correlation in, we can directly undercut the issue. And there are certain systems in place in things like schools where they notice at-risk children who seem particularly quiet or vulnerable that may be abused, and we have certain systems in place to try and treat these children. But unfortunately, as we've seen, although there's a clear improvement here, now we are noticing these correlations, which is fantastic. But there is more that we can do when it comes to awareness and helping children, and so they don't resort to crime. And through just even noticing and recognizing this straight correlation, I think that we actually can end up doing this. And I just want to congratulate people for finally just talking about it, because it seems silly, because it's something we've always known about, but we just haven't spoke about it. And finally just doing that itself, I just think it's a great improvement.
Thank you. It wasn't really a question,
No,
but please do come back. Yeah.
I do welcome that, and it's a really helpful sort of summary of some of the issues. And one of the things in our trauma work, what the things we try to think is what's happened to you rather than what's wrong with you. as a way to understand that. And obviously, my service's role is to reduce offending, because when people commit offences, they generally harm someone else, and we want to reduce harm. But we recognise that they may well have experienced harm themselves, so it's a sensitive kind of balance that we try to strike. And the government funding, although we don't know the details, they are talking about some of that relating to prevention work, so trying to get youth justice services to identify children at risk of offending before they have offended, which would, I think, go to some of those conversations that Councillor Moore just raised about earlier intervention. And when we can spot that children who are known to the police, known to children's social care as victims of harm, got special educational needs, had exclusions from school, we can start to gather that information. I think children with all those different markers, we should be just checking that they've got the help that they need.
Yes, please do.
So do you think by directly addressing these issues at a young age, or maybe improving systems we have already in place with young children, that we could help the issue?
Thanks, yeah, I do. I think it takes a collective effort, because it's across a number of different services, and the kind of difficulties in children's lives might show in different places. So we need to be able to work together as a kind of system, if you like, to identify those children and check they've got the additional support. And part of what we also do is try not to criminalise children unnecessarily. So although a child might have a proven offence, we do work with the police to see if there's ways that we can deal with it informally. So there'll still be some kind of follow-up, but it didn't necessarily need the child to be criminalised, and that's helped us to reduce our number of children entering the justice system.
Yeah, thank you. I think you've probably answered a question of mine there, whether the youth justice system gets involved with children who haven't been yet criminalised, but I think you've already answered that. Mark, you were next.
Yes, this committee's long been concerned with the number of fixed-term exclusions and permanent exclusions, and you've shown the correlation there. Is your report and is the consequences of exclusions being transmitted across to the pupil placement panels and the secondary school staff that are involved in managing exclusions?
I wonder if Sarah Rempel might want to, or did you want to contribute?
Good evening. I no longer look after exclusions and the data around that, but I do help support the Fair Access Panel. And when we have children without a school place, that Fair Access Panel, which meets fortnightly for secondary schools, we do collect as much information as we can together around any exclusions, any professional involvement, what support previous schools have provided for the young person, and we discuss the young person in depth at the meeting and try and make a recommendation based on the circumstances of that particular young person as balanced alongside the circumstances of the schools that are available in that particular area.
Okay, thank you very much.
And thank you for jumping in and answering a question that you didn't. Did she answer it all right?
I'm very grateful, yeah. And I understand that there is kind of more work being done to try to coordinate the early response so that children at risk of exclusion are getting support earlier.
Yeah, I think, yeah, it is something we have spoken about a lot, and it's very interesting to hear that. I'm looking around. Do we have anybody else got any questions?
So sorry, Chair.
Yeah,
Can you just talk about early intervention?
So it would, at that age, often that's really early years, so it wouldn't be my team working with them. What we find is that we work with children aged 10 plus, in terms of that's their age of criminal responsibility. But and obviously most of the children we work with are more like kind of 13 upwards, but they've experienced that when they were much younger. So the suggestion would be that getting the right support in at that very early stage. And from my point of view, it's not just that, there's also, we identify special educational needs that can lead to, those combinations can lead to behavioural problems in school, which lead to possibly fixed term or even permanent exclusion. So it's, I think, getting the strategic response to those issues in place, and ideally happening early enough that the child gets a kind of better future, and we're not dealing with in the teenage years with trying to repair the harm that's accumulated in earlier years.
Yes, so, yeah.
So are you looking to perhaps like heighten the sense of requirements that that someone can be permanently excluded or just suspension?
That's outside my remit. The Director of Education is on.
I mean, would you like recommend it? Do you think it would help?
It's a really tricky balance, isn't it, for schools when they are trying to educate everyone, make their school a safe place for everyone, but also trying to meet each child's individual needs. But those children do need education, perhaps more so than others. So building an inclusive environment with the right support for the school, I think, is the outcome that we all would like to see. We all want to see fewer children being excluded. But we recognise that there's quite a lot of different things you need to do to make that happen.
I can see, Sarah, if you've got your hand up.
Thank you, Chair. No, I thought I would come in for David, because that comes under the work that I'm doing and with my colleagues. So we're setting up a pre-exclusion panel where we would like schools to refer into the panel before an exclusion takes place. So we would look at what's been put in place and be suggesting other options as instead of exclusion.
Thank you. Does that answer your question? Right. Okay. Anybody else got any points or any questions? Right. Okay. In that case, I shall sum up. We've had a good discussion there. My thought is that it's quite a complex. It's lots of strings here, aren't we? Joining lots of different agencies together, and it's getting the working together, which is quite complex. So going back to the beginning, we had a discussion about gender identity reporting. We talked about the complexities of the moving target due to the rules changing on the data. We talked. I've got diagram page 30 written down here for some reason. Lots of different people with relationships between multiple people, having with a case manager, so that the young person didn't have to deal with so many people. So we had talked about the annual youth justice grant and the fact that merger has actually helped their managing the costs, but the fact that we don't know how much you're getting yet. We had a discussion about speech and language, and the relationship in first-time offenders is less than in Dorset, and the early intervention work that they're doing in Dorset. We had a long discussion in several ways about childhood trauma, what that means, and how it's an indicator, and also likewise with exclusions, permanent and temporary relationship with offending. I think that covers everything that we talked about. So thank you very much for that report. You are welcome to stay, or if you need to go.
Come presenting the next report as well.
Oh yes, you may well be. Actually,
so I'll stay.
In that case, I shall rephrase. Please stay. Yes, yeah, and I've just been reminded that we do need to endorse the report before it goes to cabinet. So are we? Right. Yeah. So we've got a. Yeah. I think everybody and that's yeah. Right. Thank you very much. So to the item 9 on the agenda, child exploitation to include information on county lines and knife crime. So this was requested by members of the committee at our planning session. So yes, I just noted, welcome back David Webb, the manager of Youth Justice Service, and I believe Jane White might be joining us on this as well, Director of Corporate Parenting and Permanence, to present the report.
Chair, I've been asked to present this. Zafar Yilkan led the preparation of this report, but he's engaged with an Ofsted meeting at the moment. So I can summarise the report, and there may be some questions that I may not be able to answer, in which case we'll undertake to get the information back to the committee members as soon as possible. But you'll have seen that the report outlines the definition of child exploitation, the different types, the kind of prevalence locally, the existing responses, and summarises the plans for development, which I think kind of I would summarise as being in the last few years, the focus has been on supporting children who are experiencing significant harm from exploitation. The recognition is that while we need to continue doing that, we also need to identify children at risk of exploitation. The business model of child exploitation, if you want to call it that, is to keep identifying new children to exploit. So we need to get upstream of it as well. So that's part of the thrust of the plans that are being described. And there's description in the report about multi-agency work and attempts to improve that information sharing and kind of joint identification of children at risk, as well as actions to disrupt adults who are exploiting children. There is I'd like to correct something in the report in paragraph 3, since it's obviously a public document. It refers to the government's Harm to Hope drug strategy, or From Harm to Hope, which was published last year. It states that, the report states that BCP ranks within the top 10 nationally in terms of youth drug use and complex needs. That isn't actually correct. What the document says is that Bournemouth, rather than BCP, is in the top 10 nationally for opiate and crack cocaine use, meaning by adults. So I didn't want the committee to think that we have I'm not downplaying the concerns about drug use by young people locally, but we're not listed as being in the top 10 nationally. So the report is perhaps slightly misleading on that front. But obviously the existence of a significant opiate and crack cocaine issue in Bournemouth does have an impact on the supply of drugs, the demand for drugs, and that has a knock-on effect in terms of the opportunities for children to be exploited in the supply of drugs.
Okay, thank you very much, and thank you for stepping in to present the report. And I hope you can answer questions, and if not, I know you'll get back to us. So I'm looking around who would like to start. Eddie.
Thank you, Chair. As you know, I've been fighting for the past 3 years to bring this forward. Reading the report, we do not seem to have moved very far in the last 3 years. Reports I've had, on the street and everything else, what with county lines, sex exploitation and knife crime, we really do, Mr. Chair, need to get on top of this. And whether we look forward to a working group or some other group to take this forward, or a multi-agency to get the working group with the other agencies and police, so we can have a discussion around the table. Because I just feel 6 months ago when I brought this and it was going to be on this committee today, it was one of the main purposes, agenda items. But I'm afraid I do not see the bottom line, where we're going forward from here. And I think we need to go forward or have some strategy. And we've heard, we're basically in the top 10, or we're not in the top 10. I certainly don't want BCP and Bournemouth to be in that group. But I think we really do. It's an important issue. Knife crime in youth is on the rise. Every day we hear about it, and the rest of what we're discussing on this item. And I just really do think it's too important not to go forward on it. Thank you, Mr. Chair.
So, I mean, that was quite a sort of a difficult question for you to answer, but basically it's how are we going forward, I think. How are we making how can we prove improvements going forward?
I mean, I think that's a reasonable summary. I think there has been a lack of progress, if I'm being candid. There have been some start again type impetuses. The oversight of child exploitation, it was decided by the previous director, the one before that, of Children's Services, along with other partners locally, that the Community Safety Partnership would lead on the oversight of child exploitation. So the Community Safety Partnership is the kind of governance structure where this activity sits. So scrutiny of that, I guess, is something that councillors will want to think about in terms of some demonstrable outcomes, and getting beyond setting up groups and having plans to develop information sharing, which should be in place to actual tangible outcomes. I wouldn't really disagree with the councillor's proposition.
So my thought is that we've got two possibilities then, haven't we? Either asking for the Community Safety Partnership to come and attend a scrutiny meeting, which I need to check whether that's organisable, or having a sort of one-off working group with members of this committee and people from several agencies probably. Sandra, you had your hand up before. And
yeah, it was just that I didn't know whether or not Eddie had made a proposal for a deep dive type working group. I think that's what he was saying, and I just wanted to second it. I totally agree with him. I think we do need to look at the issue in more detail. Yeah, I know that there was the Community Safety Partnership that were leading on it. Now, whether or not we want to do it as a joint working group or how we want to do it, we could take that away.
Yeah.
But I think the important thing is that we actually do dig and find out exactly what's going on and see if there's anything that we can do as a council to actually improve the situation.
So coming back to Eddie, you're proposing of what Sandra said there, is sort of saying what you said, that a deep dive working group is what you're proposing.
Yes, Mr. Chair, and also perhaps if I can recommend that sort of towards the end of the year, I think we've got probably an ONS in November or thereabouts, that we have an update and report back to this committee, please.
Yes, so the idea would be to have the working group in before it, and then the report back to the committee, and that's what you're seconding, Sandra. Yeah, and is everybody anybody against that as an idea, shall we say?
Chair, I was going to suggest an alternative.
Go ahead, mate.
Yeah, so what I was going to suggest was, I don't disagree with what Eddie has said, but I'm just thinking, because round the table, I think everyone here has got a keen interest in this particular topic, that perhaps we do it as, I don't know whether this is an old-fashioned way of referring to it, but what we would call a select committee style. So we have a one-off agenda item where that's the only item on the agenda, and everyone on the committee gets a chance to participate, and we invite the relevant agencies to actually then be here to actually provide the information for us. I did sit on the CSP for about a year, and I know that for each priority, of which this is one, there is a lead. So it's not as though we need everybody from the CSP. The lead and they're actually split into separate groups with a lead and various people within that group. So it really is that group that we would probably want to come to actually then be able to provide the details that. But again, it's something to be discussed. I don't think it's for this meeting to actually discuss that. So that might be another alternative as opposed to a working group, but like a one-off meeting where everyone in the committee can participate, including our young people.
Yeah. So to try to sum it up, because I want to not nail this down too much, if it to the detriment of what we were trying to do. So what we're basically saying is that we want either a working group or a committee to have a look at this. And I'm looking at democratic services for where we could take. So if we leave it that was going to happen, we work out the format and contact people and say, are we happy with this as a format? With the idea of getting it done ready for November. Is everybody happy with that? I've got a few people with hands up, but I'm going to go back to you, Eddie, first, just because it's your
Yeah,
proposal.
I think somebody's going to may recommended it as well. We mustn't forget that whatever we've got, we have an input from our young people, because that's most important, and they can give us what I call an on the spot, an update, what's happening on the ground. So I'm all for that.
Mhm.
Thank you.
Yeah, I would totally agree. Zara.
Yeah, that's actually what I wanted to talk about. So part of our job is to find out about all of the young people, how things like this are approached. So we did a forum, was it like 2 weeks ago? And we, as you see on this really nicely brightly coloured sheet, we got a huge survey on what people think about knife crime, county lines, how much awareness is out there, how it's being approached in different schools. And it's been found, well, there is a level of awareness in some schools, there's little to none in others, and if it is being approached, it's not being approached in the same quantity in every single school. And it's noted things like approaches to drugs are completely different depending on classes and schools and area and income. So we observed in higher end schools like grammar schools, we noticed that there was a higher education on why not to take these said drugs. And then in lower end schools with worse, higher rates of drug use and selling drugs, they were, instead of being taught why not to take drugs, they were taught why not to sell drugs. Now, there's a noticeable impact of how this is affecting them, because when you're not being taught why not to take drugs, you are then more likely to take drugs. So we're getting a level of awareness out there, but where it is completely differing in quantity, it's not going to make a change at all. So if there was some way of monitoring and regulating the amount and the quantity that everyone's being taught, then I think then we could stabilize the entirety of the statistics.
Thank you. That's very interesting. I can see that that's another extra reason why you should be part of the discussion. I'm just going to. I've noticed Nicola got your hand up there. I've got a feeling you've want to tell us something.
Sorry, Chairman, it was actually earlier on that I was going to interject, and clearly the committee's got a very strong feeling about the direction that it should take, and certainly that's to be welcomed in the engagement. I was just going to make the observation that under the new overview and scrutiny arrangements, of course, scrutiny of the Community Safety Partnership itself, I'm assuming now sits with the corporate and community panel, and that scrutiny, I'm sure, it's much more in Councillor May's wheelhouse than my own. So it's just whether you might want to touch base with the chair of that panel in case there was any crossover. I'm really pleased to see that the focus of your discussion is quite properly on on the children's aspect of it. It's just to note that you might just want to double check the way in which the other panel, which also has a responsibility, particularly where David was talking about that crossover in terms of scoping the piece of work that you're doing.
Yeah, thank you. I'll note that once I've sort of distilled the thoughts from tonight's evening, I shall write to the chair of that committee and tell them what our intentions are, and even invite them to join us if they so wish. Jane.
Thank you, Chair. I just wanted to draw attention to paragraph 20, where there is a proposed plan for the expansion of our contextual safeguarding team in BCP for earlier intervention and wider multi-agency partnership working. So that should be seen as a positive in terms of better collaboration and utilising of existing resources to respond to the need.
Okay, thank you for that. I shall have a good read of that paragraph as well. My feeling is, I don't know, does anybody else got any comments you'd like to? Sandra, you had your hand up earlier, didn't you?
Yeah, thank you, Chair. Yeah, just following on from that, I know that there was a proposal for the contextual safeguarding service to co-locate with the police. Does that mean to actually physically move in with them in the police station? And I'm only asking because I believe that the MASH were there or are there, from several years ago, I can remember that there was some sort of security and practical problems of children's services staff working in the police station. I don't know if it still exists. I'm just raising it because I've heard it, and I just thought perhaps Jane could update us.
That's actually a really good point, because I know a visit to the MASH is one of the things that we've been trying to do as a
It would be
committee
nice, yes.
for the last 3 years, and for one reason or another it hasn't. And I've got a feeling exactly what you're saying is one of the reasons. Jane, your hand is up. I'm looking at you anyway.
Yeah. So thank you, Chair. I'm not sure that the actual location has been confirmed in terms of the proposal yet. There are issues in relation to sitting in the police station, security linked to that, and checks that are required for people who visit the police station for obvious reasons. But planning in terms of how we work together with multi-agency, we do have, for example, the youth justice team have police within the service as well, and they're co-located, so it can be worked around.
Right. Does that answer? Yeah. So it's yeah. I must admit I do know an easy way to get invited to the police station, but I don't think we should be going that way. So yeah, I know. So my thought is that we probably at this moment pause on the questions on this, because we know what we're going to do moving forwards, and I know I've got a few questions here which I think will be much better asked in this proposed group. So unless anybody else has got anything to add at this moment, I'll just, the summing up is quite quickly on this one. So we're looking at what's happened and how we're moving forwards, and we do feel a certain disappointment about where things have gone, and the lack of, I don't like to say the lack of progress, because there has been progress, but the sort of the fact the problem is actually still growing. I think so. We've agreed to have some sort of working group. That the actual how it's going to be is still to be decided, but that will be sent out and everybody invited to join that. And that's hopefully going to be happening before November, so that we can feed back to the November committee from that. And we've also had a brief discussion about the locations. I think that covers everything. In that case, you're not feeding in on any of the other items later, are you? No, in that case, I would say you are welcome to stay and enjoy the rest of the evening with us, or you may go if you wish.
Joe, I will leave that, thanks.
So moving on to item 10, the homeschool transport. That was page 85 to 154 on our papers. So BCP Council is legally required to have a single home to school transport policy. A BCP Council policy has been drafted to replace the 3 existing policies. This was delayed from the 22nd of the 3rd meeting. And I believe Angie Hill is presenting this, and Sarah Anderson may be joining us as well. Yeah. So over to you, Angie. Oh no, I forgot your name. Your title: Team Manager Schools and Missions.
That's correct. Hello there again. So this is a return of the draft homeschool policy. It has been previously to overview and scrutiny, as well as to Cabinet to request we could go to publicly consult. That was undertaken back in January and February. We've taken the time to consider the responses received in the public consultation and to seek legal clarification of certain points of the policy before coming back to yourselves to request that you recommend to Cabinet that the policy is finalised. Obviously, everything is all in the report, so I won't take up too much time, so I'm sure you have lots of questions for me. Excuse me.
Okay, I will start with one question. It's the number of responses to the consultation. I noticed to one of the 11 responses in total, which I find quite disappointing. I imagine you do as well. And plus, when you actually look at the responses, the responses tend to be very much personal responses, not looking at the whole, what is better for children and families generally. They're looking for what's better for their specific family or their specific child. Any idea why the number of responses? I know it's a perennial problem. Every time you do a public consultation, getting people to respond is
we
an
find the
issue.
same with the school admissions arrangements. People, when they start looking at these policies, they do find them difficult, and we tried to change the layout of the policy so that we use question and answer responses in the policy, as you can see, so people can try and understand what does this policy mean for me. But in terms of the consultation, yes, we were quite disappointed, given that we sent out letters directly to our cohort of children that are currently accessing home to school transport assistance. So those went through the post, and we use the email system for all families who've applied for a school place for reception, year 3 and year 7 and year 9. And year 5, apologies, we've got 7 points of entry in BCP Council. And the majority of those families do apply online, so they're used to receiving correspondence with us through emails. We were really hoping that by doing that we'd actually cracked it, but clearly not. When you look at the communications report around the consultation, you can see there were lots and lots of click-throughs. There was over 1,000 click-throughs from various different media onto the consultation website, but those haven't resulted in people taking the time to respond. And we will keep exploring to sit and keep asking questions of our comms team as well as other local authorities on how do you crack this difficult bit about engagement. But yeah, still work to do. We were upset too, I'm afraid.
Thank you. You've answered that question really well, and it's a perennial problem, isn't it? It was also interesting to say that it's not just people who might be accessing that service. It's everybody who has, and of course you're spending their money, aren't you? And therefore, hopefully, they've got an opinion, but obviously not. Has anybody else got any particular questions? May.
It's just one. I can't remember where in the report I saw this, but it was a section that said what wasn't covered in the policy. Yes. And then it said if the child is unwell during the school day and needs to go home, then that transport to get them home will not be paid for. And I get that. But my question is, if the child has disabilities such that they require specialist equipment to transport, what happens in that circumstance? Because you can't just say call a taxi and send the child home, because that's just not going to work.
And that's the real difficulty around this. So our transport team have numerous calls every day with different issues that come up for individual children and young people. And for the example you've given, often there's a discussion with the school around how they can safeguard the child, whether that's to the end of the school day where the right transport is assured to come along, or whether there's lots of phone calls to different, whether it's the minibus or taxi provider, to see if they're able to bring someone early, or contact with the parents to see if they have means of getting their child home as well. So we have certainly the transport team have all sorts of different variations. So what this policy is trying to do is be clear on what our limitations are, but when we have a child in distress at a school, we will do our utmost to help.
Yeah, thank you.
Yeah, I've just got another point here about oh no, Sandra, I'm sorry. After you, Sandra. You didn't wave.
Actually, it wasn't a question. I was just going to make a comment about the policy, because from experience, I find that these policies are fine as far as they go, but they're always it's the exceptions and the exceptional circumstances that cause parents and everybody else the most concerns. So I was actually pleased that there is still a good appeal process, which still involves members, because in the past I've been a part of the panels that with members, and I did feel that there were times that we were able to make a difference, and it's I'm glad it's continuing.
What we've also tried to do is incorporate the STAR panel, the School Transport Appeal Review panel as well, to ensure that we as officers take enough time collectively to look at where parents have requested review, and that will help bolster any appeals that do go to the members panel, so that we can demonstrate the work that we've done. So hopefully that is a good improvement to the previous policies we've had.
Follow that one up now. Lisa.
Thanks, Chair. This might be here, but I can't find it. I'm just wondering what would happen if a child it wouldn't apply to Christchurch because they're comprehensive, but in Bournemouth and Poole got a place at the grammar school, which was then, obviously could be quite a few miles away from their home, say, 5 in some cases. Would they then get free transport? No, it would have to be there.
No,
right,
I'm afraid that would be the case. We've not had grammar school buses for many years now, and this policy is very clear that if a child qualifies for free school meals and is of secondary age, then we will support transport assistance for one of the 3 nearest schools. I do recognise that one of the 3 nearest schools isn't always going to be a grammar school, but unfortunately we just do not have the capacity, and the grammar schools themselves haven't at this stage felt there's a marketplace for them to increase the buses that go to the school themselves.
Thank you.
Okay, well, my question is just a bit about sort of wording, because it says it refers to a number of places. It refers to the type of transports that will be funded. So on page 90 on our report, I think page 41 on your paper. I might be wrong because the numbers changed on my report partway through reading it. So I think it's 1941 for you. Talk about fuel wear and tear, cost-effective and sustainable options, including bus train patterns, minibuses and shared taxis will be explored in the first instance. But nowhere does it mention any possible funding for active transport methods for pupils if they decide that is their preferred method. Now, I do imagine that it all might come in with the appeals procedure. But I just thought it might be nice somewhere in the document to plant a seed for people because if we are trying to promote active transport and active travel, the suggestion might be there.
We do have separate web pages around our active travel strategy, which is part of I can't remember where transport is in terms of service units, apologies. So that is part of their remit. In terms of us paying for bicycles and scooters, an alternative to that is fraught with difficulties, from my understanding, around our legal responsibility should there be any harm to a child or young person accessing something that we've purchased. So the transport team, outside the remit of home to school transport assistance, do a lot of work with our schools around safer walking. We have schools walk to school week, for example, and there is a lot of work going on around bikeability, cycling proficiency, and so on. So that is all there. It's just not something that this particular report encompasses.
Yes, so just taking that. So if a child was to hire a barrel bike, for instance, and have an accident, we feel that might be a problem. But if they were in their own parent's car or a taxi and have an accident, which is probably more likely, that isn't a problem.
It is difficult, but in terms of petrol wear and tear, we only have a minority of children who are taken to and from school by their parents using petrol wear and tear. It's approximately 100 of the 1,800 accessing home to school transport. And as explained in the policy, it's one of the last options we look at. And the agreement that is provided for the petrol wear and tear is around the parent's responsibility to ensure safe travel for their child or young person. I think parents perhaps are more prepared to take that risk if they are driving their children around outside of school, compared to if they had a bike or a scooter specifically for getting to and from school that we've provided. That's very different perspective and scenario for parents.
Okay, thank you. Are the anybody else got any questions on this? So are we? Or I don't think we need to make any formal proposals on this one. We just we do. Yeah. Okay. So yes, we recommend it to cabinet. So are we all happy to recommend it to cabinet? Yeah. Anybody against recommending it to cabinet? Right. Okay. Right. Thank you very much for that and stepping in and doing it. Yes, unless you would like to present one of the other items later on, of course. Okay.
Thank you.
So we're now on to item 11, which is the Children's Services Improvement and Quality Assurance Framework, which is page 155 to 160. So this is a recurring item due to the Ofsted ILACs, which specified, which added to our previous extra meeting. So for those people who weren't part of it, we have an extra meeting, our last meeting, just to look at this and what we were thinking to target. And so I believe Tammy Lawrence, who is head of QA Safeguarding and Partnership, is going to present this report. I'm just having a look. It's actually not online yet. In that case, I noticed, Sarah, you are there, aren't you? Yes. Which is, so I think we'll pause on item 11 for the moment and give the chance to the office to arrive, and we'll move on to item 12, which is Send Improvement Plan. And Sarah Rempel's going to present this one. So
thank you, Chair. Thank you. So you invited me back to update you all on feedback from our first monitoring meeting with the Department for Education, and that took place on the 27th of April. And you invited me back so you could hear what they said about it. So you can see the presentation in the pack. So from pages 165 onwards, that was the presentation that we did to the Department for Education. I won't present it to you, but just to sort of take you through it, we presented an overview of the progress of the programme, and then the progress of each of the 4 work streams, and then we also presented just those actions which were RAG rated red or amber, so we could talk through some of those mitigations that were in place. So the feedback from the DFE, so we've now had the formal feedback. It was fairly light this time because it was our first meeting. So the formal feedback that I've put on page 162 of the report, there's 2 paragraphs there. That's the only feedback that we've had on the meeting. The rest was just them confirming what we presented to them. So they have acknowledged that work has started at pace, that we have got relevant activity on all 8 of the areas of significant weakness. So if you remember, we had 8 areas of weakness, and we have condensed those into 4 work streams to make sure that the work is sort of joined up rather than having 8 work streams. So they can see the progress on that. They could see that in the majority of the cases, the delays that we had, we've got our risks have been mitigated, and we've got those actions in place. And so what they'll be looking for in July is the sort of data around it. So we will be presenting to them the answers to the questions of how much we did, how well we did it, and what difference has it made. So the next meeting will be the first meeting that they're really holding us to account in terms of the data, and then that data then we'll be looking at for all the future meetings. So in terms of another update, I don't know if we have a meeting in August, but we'll be having our second monitoring meeting in July. So the subsequent ONS, I can present a further update. Thank you, Chair.
We're going to discuss the future meetings at the end of this meeting, because we have got a couple of decisions to make on that.
Thank you.
So, but September would be on our list.
Okay, yes, that fits with when we get the feedback.
At the end of September,
yeah.
20th of September. So I'm looking around the room to see whether any. Yes, Sandra.
Yeah, I was just going to say that obviously it's the SEND Improvement Board that is scrutinising this. It's providing the challenge. There's a huge amount of work going on behind the scenes, but at this stage it is very much work in progress. We did actually look at some of the concerns been raised. There was queries around staff recruitment and also about timescales. And it's all part and parcel of the work that's going on behind the scenes, and hopefully we'll be able to update come August.
Well, I shall follow what you just said with one of the questions that I've got, because I've got recruitment written down here is the thing. How many positions are vacant and what type of roles are they?
So we've just recruited 7 new case officers, that was last week. So we have, I think, 3 of them starting before the summer, and then 4 of them starting in September, because they are currently school-based staff, so they have to leave. But it was a really positive recruitment process. We had, I think, 41 applicants for the positions, and they were really strong candidates, and I think that was a real positive. We are also currently have 2 new posts which are being recruited to at the moment. So that's our co-production officer and our participation officer. So the co-production officer will be supporting all the work that particularly I'm doing in my work stream of co-production. So that will be a great support. Somebody who is going to be working directly with our families, our parents and carers, and making sure that we are co-producing on the work that we're doing and all our policies. And then the participation officer that will be working directly with our children and young people to ensure their voice is heard. We are also recruiting to replace Simon McKenzie, who is our current head of SEND. So sadly, he's leaving us at the end of this month. So we have applications, I think it's closed now. And so we're shortlisting to cover that position. So our current vacancy, I think it leaves us only with a maternity leave to cover. But we're still looking at the sort of future-proofing the structure of the SEND service to make sure that we're going to meet the demands in the future as well.
Yeah, sorry. One of the things that I should have added was about the need to recruit more ed psychs. And there was a really interesting discussion earlier today about how we're going to attract more EPs to come and work in this area. So I don't know whether Sarah wants to add to that, but it was quite a discussion. And there's clearly it's all about thinking outside the box to get people to come here.
I should just for those people not in the terminology,
education psychologist. Sorry.
Thank you, Councillor Moore. Yes, and I'm pleased to report that that's moved on since this afternoon. So I'm already now in touch with Southampton Uni to look at how we can encourage their recruits to join us, their graduates, sorry, rather. So yeah, we had a really robust discussion, and I think the challenge was absolutely appropriate on the issue we've got at the moment is that in terms of the educational psychologists, it's really difficult to recruit them. We know it's also a national picture, but that doesn't help us here at the moment. So it's looking at what we can do to to encourage people to move down to BCP, to come and join us, looking at how we can use the university to link up with, to get them at the sort of graduate level. So we had a really great challenge this afternoon, and we will be presenting an action plan on how we are going to fill some of those posts. So we've got, I think, one vacant post. We've just had a resignation for educational psychologists, but we also need to recruit more because we can't meet the demand in terms of educational healthcare assessments, and the EdPsych is the one statutory advice that we have to have to write that education healthcare plan.
Okay, thank you very much, and congratulations getting all those people recruited. That sounds really good. That we've managed to get those people and entice them down here. Just a couple of questions from me. This is an open question. What are you most concerned about?
I think some of the things that we've moved on now, so recruitment, that was a challenge to get through our processes to make sure we were able to recruit that. So I'm really pleased that that's moved on. The main challenge is something that is almost out of our hands, which is the increase in applications for assessment for education and healthcare, for the needs assessment. That has gone up by, I think, 59% since this time last year. Certainly also since January, we have received so many more applications. The reasons why, it's possibly COVID, concerns around COVID, and I know Julia's going to be presenting around long COVID shortly. So where potentially applications hadn't been made because children hadn't been attending school regularly, and now attendance is back up. We're seeing an increase in complex needs from our children and young people, particularly around mental health needs. Now this is a national picture, but that is the one thing that concerns us, is our capacity to actually deal with all of these applications that are coming in. Now, the things we're doing to mitigate those risks is in terms of our structure of our SEND service, like we've said, we've recruited to those vacant posts. However, we are now looking at what the service will need in order to be able to meet the demand over the next 3 years and the next 5 years going forward.
Thank you, and well done. You've actually answered my next two questions there, because I've got written down why and what's stopping it from being fixed, and you seem to have covered those before I've asked them. So thank you for that. Anybody else got any questions on this? Just looking, any hands up? No. In that case, thank you very much for that. It's really interesting. Just having a quick look, we've looked at the recruitment and the success we've had, increasing the numbers and getting some people recruited. We looked at the increase in assessments. I think that's really what we covered. Could you also pass on our thanks to Simon McKenzie, because he's not here today. I know he's done a lot of work with this committee. I don't think we'll be seeing him again before he leaves.
I will do. Thank you, Chair.
That will be kind of you if you were to. Yes, do we have, no, Tammy's still not. So if we go on to...
Sorry, Chair, they have arrived.
Just come on.
Just come on. Tammy, do you need a moment before we start, or are we happy to go straight in?
Yeah, happy to go straight in.
Right. So I'll just go back to where we were. So it's Children's Services Improvement Plan Quality Assurance Framework. This is a recurring item due to the Ofsted ILACs, was added to our previous extra meeting. This is one of the things that we said we want to do today. So welcome Tammy Lawrence, who is Head of QA Safeguarding and Partnerships, who's going to present the report.
Thank you. So I assume that everyone's had the opportunity to read the report, so I'll just give a brief overview and then see if there's any questions following that. So following the ILACs, there was some feedback around the quality assurance process and the framework that we had in place at that point. And the feedback was that it wasn't embedded, that it wasn't strong enough, and perhaps didn't evidence that we knew ourselves well enough and what good looked like. So we revised and reviewed the quality assurance framework, and that has now been launched, and everyone in the workforce is aware of it and is working to it. So one of the significant things that's happened is we've now got senior leadership buy-in around quality assurance. That was significant and necessary improvements. And what that means is that there's a real commitment and emphasis that it's everyone's day-to-day business and that everyone's part of quality assurance. So you'll see from the report that we've put in a number of changes, and they're all detailed there. I don't propose to go through them, but you'll see that the impact that we've already had is that we've had that increase in compliance around PLRs, and in April we were at 70%. So you can see the trajectory is really quite steep, and our commitment and aim is for 100% compliance. So whilst we're looking at increasing the compliance, we're also really working hard to help and support people to improve the quality of PLRs. So that's why we've got a dedicated practice learning reviewer working with service areas. So within sort of the last 3 months, in a short space of time, we've implemented some quite significant changes, and we're quite confident we're going to start to see the fruits of that in the next few months. It's just whether you have any questions arising from the report.
Yeah, well, thank you for that explanation. Can I just start, because you talked about practice learning reviews, PLRs, and the changes. Can you just briefly describe what the changes are?
Yeah, sure. So previously there was an expectation that every manager completed 2 PLRs per month. We changed that expectation to 1 PLR so we can really work at improving the quality, and we've extended it to the senior leadership team and a little bit wider. So we're still having at least 10% of the work QA'd, which is pretty standard for a framework. The PLRs are collaborative. They always have been, but that wasn't happening, and it's now happening. So that means that the auditor sits alongside the social worker or the manager to complete the work. So that's where the real richness of the learning happens. We've also put a dedicated practice learning reviewer or auditor within each service. So they're sitting alongside, supporting managers to get more confident at auditing work, and they're also supporting with that learning loop. So what happens and what have we learned and what actions have been put into place, and just closing that loop to ensure that they're happening. So that's been going on for a couple of months. We still moderate 20% of the work, so 20% of the audits are moderated to check that the audit is accurate and we're looking at the right things and we've reached the right grade. And what we will be tracking is to see that that moderation shows more consistency and alignment going forward. We've wanted to really strengthen the learning loop, so we've now got an action tracker. So out of every PLR, there are actions in relation to that child, and they are on one tracker which is shared, and there's a commitment from all of the service directors and SLT and managers to track those actions, to close that loop and complete them on individual cases. And we're also scooping up all of the wider learning for that team, that service, and for the whole of children's services, and embedding some of that as well. And the PLRs also feed in, what we're learning from the PLRs will feed into any focus reviews that we might do to look at anything in a deeper, closer way. So we might audit one particular area or a particular type of work from the learning from the PLRs as well. And it also feeds in and supports the workforce development. So a number of actions that will come out of focused reviews are around workforce development. So having to tweak or change our training, maybe deliver something different or in a different way. And the actions often relate to that as well, which again, we're closing that loop. The other thing that we've done is we've implemented, or we're starting to do practice reviews, practice weeks. The first one's next month in July, where we're focusing on care experience, and they'll be happening 4 times a year. That gives senior leadership team an opportunity to have a look at practice, to sit alongside workers, to see what's going on and what the impact is for children. And again, there'll be a learning loop around that.
Thank you. That's a nice explanation. Sandra, your hand is up.
Yes, thank you, Chair. Yeah, in the report it mentions that the children and the families are concerned about the number of changes of social workers, because obviously each time they have to repeat the story and get to know them all over again. But it also report goes on to say that all this is going to be addressed by the recruitment and retention strategy. So I just wondered, how's it coming on?
Do you want to comment on that, Mr. Bevan's strategy?
Do you want me to?
Yeah.
I'm quite happy to answer that, Chair. Kathy Hadley.
Yes, please do. Yes.
Thank you, Chair. So there is a recruitment and there is a recruitment strategy options paper that is going to the Chief Exec that's being currently written with some options as to how we manage our recruitment and retention and some of the areas that we should work on that. So we are swiftly moving into a position where we get some agreement about the action and what we should be doing.
Yeah, you want to follow that one up, Sam? No?
Just ask Kathy how she is.
Yes.
Thank you very much for your concern. We're all fine, and all I'd say is the teams have worked extremely hard for day one of the Ofsted being here, and we apologise for being late, but they kept us a bit late, so we apologise. That day two tomorrow, and as and when we get the feedback and we can give you some more detail, we absolutely will.
Yeah, well, thank you for attending, and I hope you don't have too much more still to do this evening, because I imagine, yeah. Does anybody else have got any questions or comments at the moment? I've just got to. There's been a Josh McAllister report out recently, hasn't they? Which has made some sort of changes in direction, I feel. Your plans at the moment, has the report altered your change of direction, or what was that the way you were going already? I'm particularly thinking about unlocking the potential of family networks and that part.
Thank you, Chair. We need to consider the direction of travel. The direction of travel currently will be up for debate within the government, because Josh McAllister's report also puts out that there needs to be significant financial support to make some of those changes. There will be a working party that will be working with the government. Their response, I think, is due in the autumn. The government's response is due in the autumn, but they have said that they would put a working party together. The other reports that we probably need to consider and bear in mind is also the National Safeguarding Panel's reports on the very tragic murders of Arthur and Star, and some of the recommendations in that. So, Chair, I would say that we any changes that we make or anything that we consider, we will bear those recommendations in mind as the direction of travel, and we will be seeking to have a voice in terms of whether some of those changes, what we consider and feel about those changes, and then how we would develop that. But there's a bit of time, I think, before that becomes a national, there's a national direction of travel.
Okay. And I'm going to ask exactly the same question as I asked on the last one, but you weren't here, could you? I don't think you arrived. What are you concerned about?
What I'm concerned about is, obviously, if these things are put in place, but if they're put in place without some financial support, that will be a challenge. I think some of the thoughts are good ideas in terms of, do we put children in need in with early help? That's something that I think is something that we could look at. In terms of some of the other thinking about having these unique child protection teams, I'm not sure whether that feels right for children and families, but I think all of those things will be explored by the government. and also by the ADCS, which is the National Directors of Children's Services national professional body that are working very closely with the government.
Well, thank you very much for the answer. I'm just double checking anybody else has got anything to ask. No? In that case, I shall thank you very much, and thank you for attending and dragging yourself along to here. I'm sure I don't mean drag yourself along, but you know what I mean. Because I know what Ofsted are like. Just summing up, we talked about quite a lot about PLRs, the changes to it, and the improvements to the system, doing less but better, I think, is summing it up, and then tracking what's going on with those. And we talked about the changes the changes that Joss McAllister report and the direction of travel. I think that sort of sums up what we talked about. So thank you very much, and enjoy the rest of your evening. So we're now on to item 13, which is a COVID update, lasting impact to include academic progress and mental health. Julia Coleman, I believe, the service manager of the schools and provide standards for 0 to 19 education skills directorate, is going to present the report. That's a long title for a job, isn't it?
Yes, you also can't see what a short person I am on on Teams, so it's a very long title for a small
I
person.
hope you don't have to write it all on your badge then. That's all I can say.
No, absolutely. Thank you very much, Chair. So obviously, colleagues have got a copy of a report that's inside of a policy that really comes from the shared work of all schools, Bournemouth and Poole College, the universities, working together for the last 2 years. And for those of you who are new, or for those of you who don't know, we've had a very collaborative approach to handling COVID, which continues to today. And for the last 2 years, the schools in BCP and Bournemouth and Poole College, but also our friendly colleges in Dorset and in Hampshire, have worked together to have as much education on site as humanly possible, to send as few children and young people home as has been possible to do and allowed within the law. And we've also worked incredibly closely across a council, so across our health and safety colleagues, emergency planning, communities teams, the growth teams, the 10,000 plus volunteers, to try to make sure that schools and children have had as much support as humanly possible through this process. And this process has not finished for schools yet. And what this paper summarises are some of the issues which we are only at the beginning of. So whereas for some of society, we work in fully vaccinated workplaces, etc., that isn't true of schools, and particularly primary phase schools. And one of the things that schools have sought our support and the support of public health for is contained inside of this draft guidance, which is full of the support that doesn't really come from outside in the national system, but is very much locally focused. And we've shared it with Dorset colleagues as well, who are looking to adapt it for themselves. Public health is both BCP and Dorset. So the Public Health Protection Board, before it stopped its full-on focus on COVID, have also been very supportive in putting this document together. And what it summarises is that the jury is still out on the level of impact on children and young people, the organisations that are inside of them. But one of the things that has become plain as the disease has continued, and of course testing no longer is offered freely inside of schools anymore, is that children and teachers have become infected and reinfected with the virus several times. Approximately 10% of the adult workforce goes on to get long COVID, or to have systems of COVID that persist for 2 to 3 months. It tends to be diagnosed as long COVID if it lasts more than 6 months. But we've also had children who've had very, very potted journeys, particularly since certain restrictions were taken outside of school. And it's very good to see Sarah trying to hide a cat while we're talking about something so serious. What we've attempted to do is distill the learning between the schools, ourselves, and public health about how we apply what we've learned about what works with COVID to how we support children and adults returning to school after long bouts or repeated bouts of COVID, because it tends to have increasing influence on people's health and retention. So, for example, at the start of COVID, if a teacher got it, they were usually back in school if isolation allowed and if they were testing negatively. Within 5 or 6 days, they were knocking on the door asking to come back, whatever the rules are. The COVID outbreak in spring of this year saw 10,000 people inside of schools get COVID, many of them for the second and even third time. And this means that as people have got it again, some of the adults have become quite severely ill, and some children who often have very mild symptoms have gone on to have long COVID symptoms. For teenagers, that will often mean that they need treating as if they're having a phased return to work, as somebody with a chronic condition would do. It has symptoms that are very like ME. Children and young people tend to get long COVID in larger numbers. About 14% of them get it compared to 10% of adults. There's a great deal of support inside of the NHS for adults with COVID, less so inside of for children, although that's growing. And so what we're proposing is that schools have this as a model of how they approach, for want of a better phrase, the return to school, the return to work of children who have experienced COVID and get longer lasting symptoms, which can include fatigue and so on. They already have in place really good stuff around remote learning for those of them who are well enough to work for parts of the day, and they're doing great work around catch up and setting up support for mental health and well-being. But it is a very difficult process to work on when Ofsted are back up and working and expecting schools to get high levels of attendance, or certainly the DFE is. Ofsted tend to be a little bit more sympathetic. We've had very positive reports this year on how schools have tried to reintegrate children, but we're looking to offer them this as a document, as a way of supporting them in supporting children and young people back into school as successfully as possible.
Thank you. There's a huge amount to think about there.
Sorry.
Well, there is, and it's one of these. It's such a changing situation, and we don't know where things are going, and we're getting new information all the time. There is a question in this, but I don't know if there's really an answer. My thoughts are, some people are getting a single whammy, double whammy, triple whammy, even quadruple whammy with COVID, depending on their personal situations. You could have a young person who has had no detrimental effects due to COVID at all through these last few years. However, you could have a young person who has had to study at home in an environment that hasn't been suitable to study, without getting access to the right equipment, catching COVID themselves, suffering from long COVID, ending up in a school whose their main teacher has had COVID and gets long COVID, and therefore, for whatever reason, not performing at their top level, because we all know teachers do have to perform at that top level all the time. So it's very unfair, isn't it? Can anything be done to track who is being most affected? Anything to help, particularly those people who are getting those multiple problems?
So we've done an awful lot of work on that, because the school stayed open through every single outbreak, And I think that, Chair, you've hit the nail on the head, because actually, obviously, the suffering of the children is what the teachers, the teaching assistants, and ourselves care the most about. But the indirect cause of the bulk of the suffering that children have had is how frequently their staff have become poorly. So in the autumn term and in the spring term, the number of adults who had COVID and the absence rates of teachers, we have very accurate figures on that. And obviously we wouldn't share anybody's medical details, but the schools know in terms of the number of pupils. We've kept track of that. We've paid very close attention to our children in need, children who are known to social workers, children who are in the virtual school, children with EHCPs. There have been risk assessments very specifically on those. And so schools and we do know very accurately who's been in, who's been out. And one of the things that we've done, Chair, that we hope will help a little bit this year is we've given reports to schools when they've been inspected. So Ofsted have been able to assess what the impact of COVID has been on individual schools in terms of whether they've had to have partial closures and so on. What's been unfortunate is that there is part of it we don't affect, and the part of it we don't affect is that the government is carrying on by and large with assessment and testing as normal this year, and that means that unless somebody actually gets COVID or another illness during the examination and assessment time, they will not take into account the experience that the children have had in the run up to and the experience their teachers have. We've done some equality work on that and looked at the impact. Last year, children with SEND in particular did poorly as a result of COVID. So we do have pupil level data, and we have done some training with the schools to look at how we can make sure that there's been extra interventions this year. And those of you who are governors of schools and so on will know that lots and lots of schools have been open on Saturdays and organising extra tuition. It doesn't particularly help children who get long COVID, because with children who get long COVID, they need to rest. So they don't need to find more hours to try and make up the work. They kind of need to have a phased return. But yes, you're right. There are lots of questions to which we have some answers, and we hope this is a partial answer.
Yes, and I mean, I would echo, because exam board's rules are on who's allowed to have any extra time or anything for quite major things in their life are very strict. So is there anything that can be done to put pressure on government exam boards to look into that?
We have been using all of our charm and quite a lot of our regular feedback meetings with the department to ask them what they are doing, because that has an impact last year and the year before on how they did things. We're not so far. What they say is they have done an equality impact assessment, or that the examination boards have done, but they have done beyond scheduling exams, so they're a little bit far apart, so that if you miss one paper, you don't miss the other. There hasn't been much of that taken into account. So we have, for want of a better phrase, registered and evidence that because we have good relationships with the schools, we have 2 years of data where we know which groups have done well and which groups haven't in this particular situation. And we continue to press them to think about how they can take that into account if they see results plummet for some children.
Well, I know I can't offer charm for the committee, but if you can do anything else, do please let us know.
Thank you.
Is anybody? Yeah, Hannah.
I think that a lot of young people have developed mental health issues and anxiety that are caused by COVID, and the schools completely ignore it and dismiss it, saying it's not the issue as it was before, and this completely negatively impacts the students' mental health, and this it results in them not wanting to go to school, and their attendance just completely fails. And if they do go to school, they are not able to focus at lessons, and it's their grades. So I was wondering, like, how are you planning on encouraging schools to pay more attention to students and how, like, provide more support?
Many schools are providing support for exactly those issues. Most schools have got a mentoring program in to look at the children who and young people who report increased anxiety and difficulties. And what they have tried to do, because it varies enormously what the impact has been and what the response required is. So that for some of them, it's been about when you were talking about anxiety, some of the anxiety disorders that have increased, like eating disorders and so on, are things that schools already have people in place to deal with. The difficulty has been, as Sarah Rempel was talking about before, is the shortage of specialists to refer people to. So schools are being very resilient and using their own pastoral staff. And we're also working in our Team Around the Schools programme to look at getting help, not just for children and young people, but also for their families, because I'm sure you've experienced that some of the anxiety is kind of directed from their families. So they've been worried about taking the virus home to vulnerable family members, or they've had family members who've been working and teaching their children from home and feeling incredibly anxious, or they've had parents who've been working in critical jobs that have made them vulnerable in terms of their health. So everything that people can do within the limits of the budgets that they have been investing in, and there's a lot of one-to-one counselling and mentoring of young people. We also really are trying to encourage them to make it what the children and young people need. So we've had young people present to our Children and Young People's Partnership Board on the impacts of COVID, and some of them have said it's actually more support with what their next steps in education are, because feeling that that's a very uncertain world, so wanting professional support around that. And all of them have talked about wanting more interaction and self-confidence about talking to adults who aren't their parents or their teachers, because work experience and things like that have been less as a result of COVID. So we've been investing a lot in events where children and young people can meet employers, for example, and meet universities face to face rather than online.
Do you want to follow that up? Yeah, please do.
So for the support provided, do students have to go up to their teachers or pastoral lead to speak about it, or are teachers being told to look out for students?
Both. So children and young people are being actively spoken, because obviously there'll be some who will be so concerned or so worried or might be so poorly that they need school to reach out to them because they might not be attending school. So we were discussing attendance earlier. Pupil attendance has actually been quite high despite COVID, and that's because they really hated being locked down. And so the more they could be in school, by and large, the more they wanted it. So some of it has been about schools reaching out to children to check that they're okay. Some of it has been children asking for support because, as you're suggesting, there are some conditions that children suffer from and young people suffer from where they're good at hiding them. They're good at masking them from the adults around them. But also, for example, in lockdown 1, pastoral staff in schools were phoning children at home twice a week on average to check to see if vulnerable children were okay and what help they needed. So it's been a very proactive period of time.
Yeah, Zara, you were next.
Okay, so we did a forum, as I've previously mentioned, 2 weeks ago. And in this forum, it's been discussed about how obviously different schools will have different strengths. And when it comes to accessing support, it has been determined that if grades are relatively high, the students' mental health will be invalidated, as I feel like schools are most likely going to prioritise things like attendance or grades. Now, this does in essence make sense, but simultaneously this is completely defeating the point of having a help team if their primary focus isn't actually the child's mental health. I've spoken to a multitude of people, and in this forum meeting it was uncovered that while there are places where you can go to get help, it's not only embarrassing, but it's a difficult thing to talk about in general, especially if you do have failing grades. You'd more likely be insecure about it, and that is a school's main focus. So schools will tend to focus on these people. But the people with higher grades that still need this help because they've been damaged by, let's say, COVID, and they are struggling with mental health issues, and they reach out for help and then they're deemed like everything's okay, it can be incredibly damaging, and kind of the whole process is then undercut and makes no sense. So what I would like to ask you is what can we do to stop grades from having an impact on the help that children need to get and why they're not getting it?
I think it's a really, really long answer. So, so here is my best answer in a very short period of time. For the last 2 years, in many ways, grades have not been an issue in schools. And the reason why grades haven't been an issue in schools is because the government, I'm going to be blunt, for 2 years has completely and utterly got its assessment system wrong for 2/3 of each of the last 2 academic years. So the first year it got it wrong by saying that an algorithm would decide what the grades were. And the second year, it was all going to be normal when it was perfectly clear it was not going to be normal. So that meant that there was an unfairness in the system. And that was something that all educators, teaching assistants, teachers, head teachers, college principals felt very, very strongly about. And they worked very, very hard at looking at what was it that children were missing. And a lot of that was not about curriculum content, although they did spend a lot of time working on that. And so, although there were some issues, including around children with special educational needs, the vast majority of children the last 2 years did much better if you were looking at grades. And the schools were not judged those ways in the last 2 years, and most schools felt very much like they were trying to capture the best of education and mental health and well-being at the same time. And so they did their best to square that circle. This year has been very difficult because it will see a return to league tables. I have to say that as somebody who's monitored the attendance of both pupils and teachers and teaching assistants through the last 3 terms, very few of the schools, I don't mean they don't care about attendance, they do, but that their attendance issue hasn't been about driving up grades and driving up how their league tables look. It's been about the well-being of their staff and of their pupils. And that's where this paper comes from. This paper encourages them to continue with looking at children and young people and their own staff as human beings who need time to recover and get well. And we're hoping that that advice, which will include the recovery in emotional terms, will be something that the vast majority of them will welcome. It's certainly something they've all asked for.
Does that answer your question? Do you want to follow up? Of course you can.
Okay, so breaking onto your attendance comment, it's been noted that schools are attempting to prioritise attendance recently. In most schools, they're doing things like assemblies. They're trying to show that attendance does directly factor into grades. Now, students that are dealing with things like long COVID, they will tend to have more days off school, and it is incredibly difficult to get to school. And where we do have programs where they can do work at home, but even then it's still going to be difficult because they are struggling with things like long COVID. Now, when students are being told with these assemblies that not only are their grades going to be directly affected, even completely destroyed, and being told they can't achieve high grades because of their attendance when it is in fact something they cannot control, it must not only make them feel horrible, but it will seriously affect their mental health, directly leading to further issues in the future. When someone physically can't control attendance, and then I understand that attendance is incredibly important, and that's just fact. We do need to attend school in order to learn. But when someone is physically unable to attend school the amount that they would, especially if they'd like to, being told that not only will they be unable to achieve certain things, because it is known in most schools, in assemblies, they do talk about the direct effect of grades leading into future salaries and future jobs, and it is relatively condescending on the fact if you do not have above 90% attendance, not only will you not be able to achieve above a grade 6, which in layman's terms is like the equivalent to a C, I think, but it also leads into things like universities you can get into, future jobs, and that is going to have a detrimental impact on young people. And I just wish that there was a better way to go about it, and perhaps spreading more awareness on things like long COVID and these mental health issues we're having, and how attendance does need to be called to attention, but in a very different way. And I was wondering, how do you feel, is it being approached correctly? Can we improve it? Should it be cared about more or less?
I think I don't think there's a simple answer to that. I think I'm sure that some of you will have read what the paper says, and at the heart of that is that if anybody rushes back too soon, so if anybody rushes back too soon after they've had a debilitating illness, and in the case of primary age children who haven't had any access to vaccination, until very recently, and then not in an organised programme. They sometimes have incredibly mild symptoms, and then it's the long COVID that they have incredibly severe symptoms of that appears a month or so later. And what public health and ourselves are saying is that that pushing too hard too soon will have the opposite effect in the long run. So there isn't a simple algebra of if you do n number of hours, you will get n grade. But of course, yes, as you said, you do need to be educated in order to do that. But you need to be fit and well enough in order to learn. So this paper very much argues that both in terms of staff return and which, as the chair has said, undermines the children's success, whether they're in school or not. And in terms of the children's return, it's really important that they're recovered when they return to school. And that's very much the spirit of the guidance that we've been giving to both families and children and to the schools.
Thank you for that. It's a complex issue. I think that's going to be my summary. It's complicated. But Lisa.
Yes, just quickly. It's very concerning that many teachers I know are absolutely they've just had enough, and they're really tired and looking for, to get out of the profession. And there was a poll, there's an article in The Guardian saying a poll shows nearly half of teachers in England plan to quit within the next 5 years. And in a survey of 1,788 teachers, a fifth said they would leave within 2 years. What's going to be done about this? Because it's really concerning that really good teachers who were keen and sort of at the top of their profession, motivating the kids, are now feeling that they've just had enough and can't cope.
I think there are many things. So there was already a recruitment crisis before COVID. Is the first thing to say. The other thing to say is that there's a labour shortage right across the country in just about every field. And in BCP as a conurbation, there are many organisations that are short of staff. So for those of us who are former teachers and who work with schools, they have had a run 2 and a bit years, and they have worked incredibly hard. One of the things they've had here that they haven't had in many other places is they've had the really huge support of the community, the council, individual council teams, in order for them to do what has been a phenomenal job. And they've also they've also been told that. And so, yes, they are very tired. And they have carried an incredible burden for us as a community, but they are thanked, they are believed when they tell us about what it's been like for them. And one of the reasons that this paper exists is because they are two parents who have children with long COVID, and they are also people whose partners are putting them under a lot of pressure to leave the profession, because they are still the only workforce in the UK who are working, at least 60% of them, with the unvaccinated. And so that does lead to them being more vulnerable. In terms of what we as an education service do, is that some of you will be aware that we ran our careers and apprenticeship show in March, which saw almost 5,000 children in BCP come through the doors to look at careers. And we really raised the profile of both social workers and of teaching as professions. We've got to start young. We're telling them what an important and special group of jobs these are, so that they see that as an important part of coming to work for us in the future. And it really rejuvenated their sense. We have a lot of schools who train other teachers, and they are getting some of their enthusiasm back. I too have lots of friends who are exhausted and tired, and they will have their holiday and they will come back. And a lot will depend on what happens in the cost of living crisis. A lot will depend on housing, and a lot will depend on whether we have another big outbreak, because I don't think they've got another big outbreak in them.
Thank you. It's encouraging.
Okay, I think we've probably talked about that one now enough. Although I do know we could probably carry on for quite a long time. And I say to some of it is complicated, isn't it? There's so many factors here, and there's so many factors I think we've probably still to discover. So we've talked a lot about long COVID. We've talked about the complex effects. We've talked about mental health. We've talked about school support pressures on both pupils and staff. And the effect it's having on them, both their performance, their results, their health, their mental health. We've talked about a lot of things. We have to, the committee requested to review, support and agree the attached draft long COVID recovery attendance policy, which will then be shared as a guidance with support for BCP schools. So are we all happy to say that we think that should happen? Yeah. Looking to see, we should shout no. In that case, thank you very much for that very, very detailed explanation. And we're going to move on to item 14 now, which is the portfolio holders update. Nicola, it's over to you for keep it less than 3/4 of an hour, please.
Richard, I shall do my best, and congratulations to you and Sean. Look forward to working with you throughout this municipal year, as I have done in the past. It's been such an interesting scrutiny meeting, and thank you to members for your discussion, and indeed to officers for their preparation of papers. Covered quite a lot of scope of children's services tonight, so I won't be tedious in terms of what I've been up to, because you've scrutinised at length quite a lot of that. But I did want to perhaps bring forward a bit of a highlight of something to come. And this is not an excuse for everybody to say, oh, I'm terribly busy that meeting, but you will know that one of the issues at the heart of schools funding is the pressure in the high needs block. And the reason I wanted to mention it today is obviously you'll be seeing the quarterly monitoring papers and the budget outturn coming through in the next cabinet cycle. And clearly there's a direct line between the work that you do as a panel and those papers. And it really is, as I say, just a taster of what's to come, and to highlight that the work which we've been talking about for a long time through the appreciative inquiry, and indeed as part of the response in the written statement of action, of work that's going on about rejigging the funding for children in our mainstream schools with special educational needs and disabilities. It is actually, it's happening very much at the pilot stage at the moment. A few schools are involved, and of course any feedback that they give will come over the summer, and then we're hoping that your panel will be looking at the proposals as we go forward in the autumn when we've got some more information. Nothing more than that to share at the moment, other than to let you know that it's a live piece of work. It is, of course, rooted in work that the subgroup of the Schools Forum have designed, working with finance officers, but also working with the SEND team as well. And to say really the point that I wanted to say is that it's underway, and hopefully by the time it comes to you, you will see the fruits of it. It's a huge piece of work, and we know that the change in the whole system of getting us closer to our comparators of the number of children that we managed to retain in spite of with their special educational needs in our mainstream school, rather than them going into the independent and non-maintained special schools, it's going to be a long piece of work to change that balance. But this is the we really have got that piece of work underway now.
Thank you very much for that. I don't know if there are any questions on that. I think probably. Yes, I think we do. In that case, item 15, forward plan, just to note really, there's quite a lot on it, particularly the meeting dates. Now there's a change to the number of meetings that we are allocated per year from 6 down to 5. However, my thought is leave at least the 26th of July date in place as it is. The trouble is our dates are sort of put there, and a lot of the forward plan has been meshed around those dates being where they are. So we've got several possibilities. We could end up sticking with those dates and not having a big gap at the end of the year. We could start moving some dates to fill up that gap. Or of course we could have the option of asking for an extra meeting near the end of the year, and we'll have to play it from there. But I'm saying at the moment, next date, 26th of July, and we'll take it from there. In that case, I think we've covered everything. We went over it by a little bit, 12 minutes. But meeting's closed.